Thank you, Hong Hai. I think it's a wonderful talk. So much for us to ponder over. We have two panelists. The first panelist is Professor Tan Jae-hoon. She's both a psychiatrist and also a pharmacologist, and very keen on TCM. In fact, Jae-hoon and I have published a paper in the British Journal on the practice of TCM here in Singapore amongst some of our patients, because we realize that many patients come to see us. They also see the TCM doctors, so they see both sides. And she's also a wonderful teacher and won prizes as the best teacher in the Yong Lulin School of Medicine, and also recently the editor of the World Book on Psychiatric Education. So the second panelist is Professor John Wong, a very renowned child psychiatrist and the director of the Mind Science Center. John is also the editor of the first World Book on child mental health. So both of them are also familiar with traditional Chinese medicine, and I hope they will ask some searching question to our guest speaker. So now to both of you now, Jae-hoon and John. Start with Jae-hoon first.
So Hong Hai, it's so nice to hear your talk and to share with the audience about the lifestyle of Blue Zones as well as TCM way of life. There are many people that are not so old or not so young, but may not be healthy. So there's a TCM way of life to help them live long. Maybe at 65, they don't suffer so much. And a large part of people that come to medical center, other than the three highs, hypertension, diabetes, and high cholesterol, a large proportion of people suffer from gastric problem. We call that IBS. So the doctor will make them go through the scope. We call it the upper scope. Then the lower scope. After the scope, 90% of the people are normal. Then they label them irritable bowel syndrome, IBS. Then they can't treat anymore because everything is normal. Then they send them to psychiatrists to treat their mind. So would you kindly help us to understand how to improve the gastric and the colon function to reduce the suffering of the people with IBS?
Yes. Actually, this is a favorite subject of mine because I personally suffered from IBS when I was in my 50s. I was living a busy executive life, eating irregular meals, traveling across time zones. And I had quite bad IBS. And I went through many Western doctors who gave me proton pump inhibitors, charcoal, antacids, the whole shebang. But I never got better until I met a Chinese physician who then told me, okay, first of all, I had lunch with the Chinese physician and I bought him lunch. And after lunch, he said, thank you very much for such a nice lunch. But you know, this lunch is very unhealthy because it was oily, it was fried. And he said, you know, if you have IBS, this is wrong food. Actually, IBS, turns out, is a combination of certain deficiencies in your Chinese kind of deficiencies in your gastric system, in your digestive system, as well as of stress. And in Chinese, we say stress mainly harms your liver. Of course, the Chinese liver is different from the Western liver. We won't go into that. The Chinese can't, right? So if you look at these two main causes, let's take first the one that directly affects your digestive system. It can be because your qi is weak, and qi is a driving force in your digestive system. It promotes what we may call motility. So qi sometimes get stagnated because you have too much what we call shi or dampness. So you might need herbs that reduce dampness. You need cheat tonics for the digestive system that push the digestive system along. So the best way to treat digestive system problems due to qi is to teach cheat tonics. But the cheat tonics must be customized to each person, because some people may be warm, some people may be cold, but basically to strengthen qi so that you improve motility. The other cause of IBS is stress. Stress harms the liver, and the liver, by Chinese theory, has a direct impact on your digestive system, your pH, so to speak. So when you are under stress, your liver becomes hyper, it becomes exuberant, and it damages your digestive system, causing you to secrete too much gastric juice, sometimes to have spasms in your stomach, in your alimentary canal. But there is a direct stress emotional effect of the liver on the digestive system. So in these cases, we will treat the liver. We will give herbs that calm your liver, calm your body down, sleep better, have a more tranquil life. And it is only when you calm your liver that you can calm your digestive system. So I went through that with my Chinese physician, and within about 2 weeks, my IBS was mainly healed. So I'm a great believer in TCM for IBS.
Thank you. That was wonderful because it is so individualized.
Yes.
So the treatment is individualized, whereas in the Western medicine, it's one for all. Proton pump inhibitor, omeprazole for all kind of people. You reduce the acid. Actually, is important to have acid, but now you stop the acid.
Yeah, the PPIs are mainly for symptomatic relief. They don't necessarily go to the origin of your IBS.
Yeah. Now the worst thing is long-term treatment with PPI can cause cancer of the gastric area. So that is something that we have to be cautious.
Yeah.
Thank you. Go back to Chairman, Professor Kwa.
Well, I agree with you, Professor Tan Jae-hoon. I think the traditional Chinese physicians, it's more, I think it's more personalized. And I tell you, they are good listeners. I think besides dining with Professor Hong Hai, the physician also listened to him, and Hong Hai will tell him about all his stress and being the CEO of Harper and all that kind of thing. So he's a good listener. Something which we must, and in Western medicine, must learn. We often tell our doctors they must be a good listener. But the doctors in the polyclinic told me, Professor, you all tell us all this wonderful thing about good listener. In the polyclinic, we have only 3 minutes or 5 minutes a patient. There are 50 people waiting for us. But I'm sure, Professor Tan Jae-hoon, you being a very good educator and a trainer for the medical students, you should think of ways to teach them how to be a good listener, even if it's just 3 minutes. Something for you to think about. Okay, Professor John Wong, anything for Professor Hong Hai?
Yeah, thank you very much, Prof. Kwa. And Prof. Hong Hai, thank you for a very elegant presentation, articulation of the framework. I especially like what you mentioned about comparing the Blue Zone and the Yangtze framework. I was just wondering, you mentioned that longevity should start through a healthy lifestyle, and obviously I think we should start young. And among our attendees here, many of them actually are senior colleagues. They have children, they have young children or grandchildren. How should we actually frame the approach to help our younger children, even their grandchildren, to really slowly assimilate this concept of Yangtze, especially built into their lifestyle so that they have an earlier start towards their later years in life? Over to you, Prof.
Yes, I think whatever applies to the elderly also apply to the young in terms of lifestyle. Regularity, going to bed at the same time, waking at the same time, and to be on the move, not to be cooped up in the study, looking at the mobile phone. You know, he's got to get up and walk around, play, mix around, and diet, of course. You know, we should teach our children not to take oily, fried, and sweet foods, you know, which lays a bad foundation for their health. But most important, I think, is to teach them to appreciate nature, to appreciate music, to appreciate companionship of friends. These are lifelong skills that will take them through life. And of course, if those who have some deficiency because of genetic or other factors, there are some tonics for children too. For example, children that tend to be overexcited, sometimes Lingzi can help. Lingzi has some calming effect. And those who have difficulty in concentration, a little bit weak, a little bit of ginseng may be helpful. But again, depends on if it's warm, then you give Chinese, American ginseng. If it's cool, then you give Chinese ginseng.
Thank you.
I was looking at the chat box. Most of the questions come from women in this among the audience, and they want to find out from you, Professor Hong Hai, what kind of tonics can they buy? They are mainly pioneer generation people. I think Aileen and Dora, and what kind of tonic to buy over the counter?
Yes, as I said, the tonic must fit your constitution. So very roughly, the 4 categories of deficiency are qi weakness, blood weakness, yin weakness, and yang weakness. Sometimes you can have both. You can have qi as well as yin weakness, or you have qi and yang weakness. But let's take them one at a time. So the most important thing is to first determine what kind of deficiency you have. Now, you can do that either by seeing a Chinese physician, or you can read enough about Chinese medicine or take some course in Chinese medicine, introductory course, so that you can help identify for yourself what kind of weakness you have. If it is qi deficiency, you take qi tonics like astragalus or pakei, Chinese ginseng, Chinese yam, and so forth. But if you have yin weakness, and which a lot of elderly or middle-aged women tend to have, yin weakness, then you need to take those that are nourish yin, things like lily bulb, yi zhu, some American ginseng, jiao, and so forth. There's a whole lot. I've listed some in the slides. So the most important thing is don't take the wrong tonic. There is no one tonic that fits everybody. Right? Not everybody is suited to ginseng. Not everybody is suited to bird's nest. So important thing is know a little bit about the fundamentals of Chinese medicine, or see a Chinese physician to determine what kind of deficiency you have, then take the tonics. You cannot go to the Chinese medicine shop, buy a big pack of tonic herbs, boil it and say whole family take it. All right. You may be causing more harm than good, because some may be hot and you're making them hotter. And some may need a yang tonic, instead you give them a yin tonic. So a little bit of basic knowledge is important before you take tonics.
So we are hoping that Professor Tan Jae-hoon in the laboratory will come up with a test, a litmus test. If you put it in your mouth and it's red, that means you have too much of yang. If you have blue, you're much more yin. So it's easier for people to know.
Right,
so
right.
Wondering, they're not too sure. So something for you to do, Professor Tan Jae-hoon, future research.
Can I ask? Thanks, Professor Kwok. I take that to be a good hypothetical question for a PhD student. I would like to ask Professor Hong Hai another question. Mr. Chairman, can I ask Professor Hong Hai?
Yeah.
Yes. So, Prof. Hong Hai, you mentioned about that qi and the blood and the yin deficiency, and it's only 4 types, but humans are made up of more than 4 types. Can it be a 20% of qi deficiency and 80% of yin deficiency, or 20, something that. Because if you look at the market from Yi Sang and different kind of store, they sell such things like 四神汤 or the 六味汤 or the 十全大补汤. So there are different kind of thing that the inside will have the Chinese yam, they will have the geiji, they will have the 那个不同的 a little bit of 莲子 a little bit of 芡实. So how do you comment, you know, when they buy a packet of 汤四味汤六神汤 then 十全大补汤, who can drink that kind of soup?
Well, in this talk, I have simplified things to 4 deficiencies. But actually, in more detail, there are more than 10 types of constitutions. There are those that are, say, have dampness, 湿. There are some that have wind, 有风, and so on. So there are more than 10 different kinds of constitutions. And more importantly, a person may have a combination. You may have dampness as well as qi weakness, right? So it needs a little bit of diagnosis to determine where exactly you are in that GPS map, so to speak, you know, whether you're more damp or whether you're more dry, whether you're qi weakness or blood weakness. And having identified your particular spot in that constellation, you can find the right combination of herbs for that. Now, that is not a skill that comes easily. That comes with training, and it's usually either somebody who is very good in Chinese nutrition or a TCM physician. Right? But if you read enough and you attend more courses in Chinese medicine, you may get enough knowledge to be able to tell. But it is important that you don't take the wrong tonic for yourself, because a wrong tonic can do more harm than good. For example, if your body is already warm already, you go and take Ba Zhen Tang. Ba Zhen Tang is very hot, very warm, and very pu. You can get a sore throat, you can get headaches, your blood pressure may go up. So it's important when you take tonics to know where you are in that spectrum. But by and large, if you take small amounts, then a cheap tonic is usually quite safe, because most of us can do with more cheap. Right? Cheap tonics, and the safe cheap tonics are things like Chinese yam. Because Chinese yam is, Huaishan, you can buy the fresh one or the dried ones, and it's a very mild cheap tonic, and almost everybody can take Chinese yam. Right? So is Pak Kei. Pak Kei, unless you already have some fever, you're very heaty. We say heaty jet. Pak Kei is a good cheap tonic, and so forth. Right? So Jae-hoon, you're quite right. In real life, it is not a simple case of just qi weakness or yin weakness, but it is what we call a complex syndrome. You have 2 or 3 different syndromes, and that makes up your particular constitution. But it's a rather complex story, so I have not gone into it in this talk.
Thank you, Prof. Hong Hai.
Professor John Wong, the Mind Science Center is very well known around the world now, and a non-drug approach in building mental resilience. Is there any future research initiative to introduce DCM, for example, Lin Zhi, because I believe that the Mind Science Center is very organic. Our program is not fixed in stone. It keep on moving on, and that's what makes it very exciting. Anything you have in mind?
Yeah, thanks, Prof. Kwa, for asking. I think as Mind Science Center does research in non-drug approach to enhancing the cognitive performance and emotional resilience, there are a couple of things that actually myself and other colleagues are very interested to pursue, and we're definitely happy to explore with Prof. Hong Hai and Prof. Tan Jae-hoon and colleagues of a like-minded area of interest. One is really from the study of cognitive performance to look at the range of different kinds of ginseng nosite that may appear in either the Chinese Panax ginseng or the American Hua Qi or even Korean ginseng. They come in different kind of representation and presentation, how it could enhance an individual's cognitive performance in our community population. There are a lot of research going on in the laboratory, so I think what we are really interested to see how it could be translated in our community people. And of course, the other important area is with the current COVID, there's a lot of interest and excitement to see how the natural herb could enhance our immunity. So obviously, there are many possible herbs, and one of those that have been recently researched on will be the cracked paws of linzi, which has been touted to have some elements of possibility of enhancing some aspect of immunity. So those are the things that will be interesting to explore with our panelists and also with our guest speaker, and also any of the other colleagues who are interested. Over to you, Prof.
In this area, you are now a member of the Mind Science Center, Hong Hai.
Okay, accepted.
In terms of funding, I'm very glad that to mention that Mr. Tao Hing Tan has set up a fund called Mind the Gap Mental Health, and where people are not too keen to finance, this fund can help to fund some of the studies that you have. I think the wonderful thing someone told me, we were invited to present the program called HUL Everyday program in Finland, and the people in Finland were quite surprised because they said this is the only program they know about on dementia prevention, which talks also a bit on spiritual health. The mindfulness part is something on spiritual health, which Professor Hong Sai mentioned about. I think so. Something very interesting. And as someone who asked about the Mind Science Center, in the last 4 years, make impact into the community to the HUL Everyday program. Will they introduce DCM in future in other centers? So just a correction, although it's 4 years only, the idea of dementia prevention been on here in the department for almost 15 years, and it's taken us a long time because we have no funding from the authorities. But I'm very glad that the public came out to support us, the Kuan Yin Hu Cho Temple, the Lee Kin Ta family, and many donors came out to help us out in. And the HUL Everyday program is preventive medicine in the community. So in Singapore, the program may be a small step in preventive medicine, but if it's adopted by more countries around the world, it could be a giant step for humanity, that we are not only delaying dementia, preventing depression, but also stabilizing hypertension and diabetes. So Professor Hong Hai, anything else to add before we round it up?
No, I would say the basic guidelines for longevity and good quality of life are basically quite simple. Regular life, right diet, nourish your spirit, and have a sense of community. They look very simple, but they're actually very difficult to follow, and it requires a lot of discipline and effort. But once one can master it, one can have a good probability of living the life of the Blue Zones, or the traditional Chinese Yangshen.
Good. Yeah. Professor John Wong, anything to round up?
I think I've just got one point to add is really appreciate Professor Hong Hai for really helping to bring the important subject of TCM to this area of investigation, because this is always one important area that address the blind spot of what we normally learn or research on. And I think the future collaboration between the so-called traditional Western medicine and TCM actually will augur much better for knowing more of what we do not already know. So thanks, Prof. Hong Hai.
Thank you.
Professor Tan Chee Hoon, any final thoughts?
Yes. In the chat question answer there, some people ask the question, a person can be both yin and yang deficient, which we know that it can be a few percentage of this and a few percentage of that. And the person who asked this question is, then how did they choose TCM to tonify their weakness in yin as well as the yang deficiency? So Prof. Hong Hai, we still want to squeeze a little bit out from you for the audience that participated in this afternoon.
Yes. This question of being both yin and yang deficient is a little bit of a theoretical issue. In theory, it should not be possible to be both yin and yang deficient. Either you're yin or you're yang or you're neutral. Yeah? But there is a morbid condition in Chinese TCM. It very rarely comes across when a person is both yin and yang deficient. But that is a state when the person is in really bad health, you know, which is almost near death. Then both your yin and your yang plunge, and you know, it's a very difficult condition to treat. But it is very rare and it doesn't happen. In normal life, we either yin or yang deficient or neutral. So I would say that there's nobody in today's audience who is both yin and yang deficient. So I would say just keep it out of your mind. Don't even think about it.
So I hope the person who asked these questions will have heard Professor Hong Hai's reply. Thank you, Prof.
I think Professor KT Fu has a question about how to tell the difference between, how do you know whether you're deficient in yin or yang? I thought you answered that in the lecture, Hong Hai.
I could repeat it because it's a fair question.
Maybe, Prof. Fu came in a bit late.
Yeah, when you're yin deficient, it means that your yang level has become higher than yin because yin has become deficient, and yang is associated with warmth. So you feel hot, your hands are warm, and you tend to feel dry, your eyes are dry, and you tend to feel vexed, you know, you feel vexatious, you get irritated easily. And we sometimes associate that with menopausal syndrome. When women are going through menopause and having a hard time, they tend to be very irritable, they have hot flashes, have dry eyes. But men also can get it, you know, depending on circumstances. But the distinguishing feature of yin deficiency is that you feel dry and you feel warm. And you feel thirst that cannot be quenched by drinking water. You can keep on drinking water, but you still feel thirsty. That is classic yin deficiency. And a yang deficient person is usually pale, afraid of cold, and also lacking in energy. Yeah. So yang deficient, a lot of older men tend to be yang deficient. And they tend to be cold, they don't have energy, and it's sometimes associated with low testosterone, yang deficiency. So a yang tonic is often also a slight testosterone booster for men. But a yang deficient person, he feels cold, feels pale and cold, and he doesn't feel thirsty.
Now there are more questions coming in. There's anonymous attendee who asked twice already. Can Professor Hong Hai tell us, is Korean red ginseng yin or yang?
Korean red ginseng is a qi tonic, is a strong qi tonic. Actually, Korean ginseng is the same as Chinese ginseng, but it has been grown in the Korean area and it's been processed in a certain way so that it turns a redder color and a darker color. And that processing makes it even warmer than fresh-grown Chinese ginseng, but it is actually the same root as Chinese ginseng. So Korean ginseng tends to be quite warm. It also has a bit of yang tonic function. Chinese ginseng has a bit of, it's also a yang tonic, so it's a qi tonic as well as a yang tonic. The Korean ginseng is normally not suitable for people who live in the tropics, in the warm weather, because it's already quite warm. So if you take a lot of Korean ginseng, you tend to get a sore throat, you may get flushed face. And there is some evidence that for some people, it may actually raise the blood pressure. So I would say that if you're young and strong, don't take Korean ginseng. Korean ginseng may be suitable for somebody who is very feeble, whose qi is very weak, who's very afraid of cold. And some Korean ginseng might be helpful. And it is not that different from Chinese ginseng. As I said, it is a processed form of Chinese ginseng. It's the same root, actually.
I gave Professor Hong Hai a break for 1 minute while I asked Professor Tan Jae-hoon, because someone asked, I think it's Genevieve, who asked, is metformin good for longevity? It's more a pharmacological question for you, Jae-hoon.
Person who have read this, metformin has been in the market for more than 60 years, and it is being touted for many things. Besides being a drug used for diabetes, now there are people who talk about how to take metformin to prolong life and have a healthy life. We can take this offline because metformin has too many articles, and come to the point whether we should actually, everyone should take a bit of metformin. So that is still a research question, whether a person should do that. Off to you.
Sure, I think Genevieve, because we know you're from RSVP, maybe in the next AWD discussion, you can raise this question again to Professor Goh Lee Gan. Elizabeth Rothschild wants to ask Professor Hong Hai about tea. She didn't say whether it's Chinese tea or English tea or Sri Lankan tea, but tea. Is tea good for your yin or your yang of longevity?
Well, as I indicated in one of my later slides, there are different kinds of tea, right? There's green tea, there's oolong tea, there's black tea. Black tea is English tea is I say black tea. English tea belongs to the warmer variety. They have been treated, they've been fried and dried and so on. There's a processing, all teas are. The teas that are not processed are mainly the green teas. Right? So the green teas are cool, whereas the darker teas are warmer. And English tea belongs to the category of a warmer kind of a tea. So if you have a stomach that is a little bit weak and susceptible to things that are too cold, I would not advise that you take green tea. You're better off with the warmer teas like oolong tea, Tie Guan Yin, Pu'er, and English tea. English tea is black tea. It's considered a darker, warmer tea.
There's so many other questions coming in, but I thought time is catching up. This one, a bit of publicity for Professor Hong Hai's clinic. So this person asked, do you run a course? And if not, where is it? And for some of you who have not been to his clinic in Renhai, there's a lady up there that brews very good tonic. So Hong Hai, can you tell us something about your course you're running and the tonic from that Johor Bahru girl who the restaurant?
Well, regarding the course, we have been running a 24-hour, which is 8 lectures of 3 hours on Saturday mornings. So it runs for 8 weeks, in which we go through all the principles of Chinese medicine, introduce some herbs and some basic knowledge of acupuncture and diagnosis. We used to offer it twice a year, and it is supported by Skills Future, and we hope also by Silver Academy. It used to be very popular, and we've been running it for about 7 or 8 years. We stopped temporarily recently because of the COVID situation. So we are now in the process of introducing an online version of it. So which we will just look at our website, renhai, renhai.com.sg. We should be offering an online version before long, but we do offer such courses and a few other courses too. We also want to offer a course in the very detailed course on how to use herbs for cooking different kinds of tonics, different kind of treating heat, dampness, and so forth. That's a more specialized course, but you take that only after you have taken our introductory course. So look at our website and look out for it.
So they also have a very nice restaurant.
Yes, I should say we had one because of COVID, we had to stop business for almost a year now, and it's a bit of an effort to revive it, under present circumstances. But I hope one day we'll revive it.
So I must bring it to a close. I must thank the three speakers, Professor Hong Hai, Professor Tan Jae-hoon, and Professor John Wong, and of course, Mr. Tao Hing Tan and Dolly, who are listening to this webinar. Last Wednesday, we invited for lunch by Mr. Tao Hing Tan, and we were told that by Professor Hong Hai that he has agreed to give one more lecture 3 months from now on nature and Chinese poetry. And as he was talking about culture and Yang Shun, I could see that Professor John Wong and Professor Tan Jae-hoon and Mr. Tao Hing Tan were listening very attentively. And I was watching them and enjoying the Teochew food. A line came to my mind, a line from a poem by Oliver Goldsmith, and it says, "And still they gaze, and still the wonder grew, that one small head could carry all he knew." So thank you very much, all of you, and have a wonderful weekend. So May, back to you again.
Thank you. Thank you, everyone. Thank you for attending today's webinar organized by the MyScience Center and submitting all your questions. Unfortunately, we do not have enough time to answer all of them online. Remember to follow us on our Facebook and tell us one takeaway from this webinar to win our latest book and a limited edition face mask. I certainly would like to start with having more regular living habits, eat less, and exercise more. Once you leave the webinar, you will receive a survey on the presentation, and we will appreciate if you could give us your feedback. For those who want to find out more about Age Well Everyday program to age healthily and happily in place, please visit our website. Our next webinar is 12th December, entitled Depression, There's Hope. Do sign up early for it. On behalf of MyScience Center and our presenters, thank you for joining us today. Have a blessed weekend and stay well. Goodbye.